Welcome to this month's edition of Focus on Health. I'm your host, Dr. Barbara Brookmeyer, and today our special segment will be about an overview of the cancer screening programs at the Frederick County Health Department. And our special guest is Mary Jackson, Coordinator of Cancer Screening and Education at the Frederick County Health Department. Mary, welcome.
Hi, Dr. Brookmeyer. Thank you.
Yes, thank you for joining us. So let's just get started with why are cancer screening programs important?
Cancer screening programs are important first and foremost because it gives the resident an opportunity to participate in their health. And with the improvements in prevention messaging, early detection, treatments, we're seeing a decline in the incidence of mortality of cancers in Maryland as well as Frederick County. So it's just the mere fact that people are participating that's making a difference.
Boy, that is good news to hear that there actually is a difference in people's, the rate of people dying.
Absolutely.
Yeah. So what screening programs are available, cancer screening programs available at the Frederick County Health Department?
We have 2 cancer screening programs available at the Frederick County Health Department, and they're funded by the Maryland Cigarette Restitution. We have our BCCP program, which is called the Breast and Cervical Cancer Program, as well as our colorectal cancer screening program, and both of them have been around for a long time. But the Breast and Cervical Cancer Program enables a woman in Frederick County who is 40 years of age, uninsured, who meets income guidelines to be enrolled in our program. Once she's enrolled in our program, she's entitled to a clinical breast exam, a Pap test, and a mammogram. Now, our colon cancer screening program is for both men and women. That's 50 years of age. Again, you have to be a Frederick County resident, you have to meet our income guidelines, and be uninsured. With the colorectal cancer screening program, if there's someone out there that's had cancer or has a family history of cancer, they are also qualified to enroll in our program. And once they're enrolled in our program, they will be seen by a local gastroenterologist who will then perform a colonoscopy.
Oh, okay, okay. Well, I think you might have just sort of answered my next question, which is, are people actually screened at the health department?
No, we don't screen at the health department, but we do have contracts in the community with providers, gastroenterologists, labs, and radiologists. And through the help of the community nurses at our health department, they will schedule and navigate them through that process. So no, they're not screened at the health department, but we do have providers in our community.
Okay, great. And then the health department coordinates all that.
Yes.
I'm sure that's very helpful. So how do people in the community find out about the cancer screening programs that are available?
That's a good question. An important part of public health is education, and we do a lot of education outreach in the community. We actually participate in community health fairs. We have a presence at the food banks, Mission of Mercy, and churches. So we make every effort to be out in the community because you have to reach them in order to teach them. So education outreach is important.
I like that. You have to reach them to be able to teach them.
Absolutely.
That's great.
Yeah.
So I know screening is very important, but what else can people do besides screening or in addition to screening to help reduce their risk of developing cancer?
Well, you know, with anything, common sense in terms of just having a healthy lifestyle. If you want to reduce your chances of diabetes or cardiovascular disease, you know, you have to have a healthy lifestyle, which means to eat healthy, physical exercise, avoid tobacco products. It's just a common sense kind of thing to do.
Well, a lot of people recently have been talking about the healthcare reform or the Patient Protection Affordable Care Act. Can you tell me about some of the provisions in there that are supporting cancer screening, healthy lifestyles?
In terms of the affordable care?
Yes.
Okay, the affordable care, we're actually beginning to enroll for the affordable care as we speak. The affordable care will actually take care of the same cancer screening services that we provide, but the beauty of it is that there's an expanded medical assistance as well as private insurance, and what we're able to do in our program is good and we enjoy doing it, but it's limited. Once a resident enrolls into the affordable care, they have comprehensive insurance, and that's a much better deal. So, you know, we love serving our clients, but we do encourage them to enroll in the affordable care.
Okay, because everybody's insurance plan, I guess even if they have high deductibles, they should be eligible for no-cost screenings that are the recommended screenings at the recommended ages.
Absolutely.
Okay, so that's good. So even the people out there who think, oh, I have such a high deductible, I can't afford that, but the cancer screening programs are, the cancer screening tests are covered at no cost.
They're covered under that. There's a list of preventative coverage for the affordable care, and our colorectal cancer screening would be included in that, as well as the well women's exam. So it's again a pleasure to serve our clients, but we do encourage them to enroll in the affordable care.
Right, right.
Yeah.
So can you tell me, how about what options are available for persons who aren't eligible for the subsidized insurance plans available through the Patient Protection Affordable Care Act, and also aren't eligible for the public insurance known as Medicaid? If
they are ineligible for the affordable care, we will still, we encourage them to contact us, because we will be able to serve them. Again, with the affordable care, it's your best deal, but there will be clients and individuals in the community that will not be eligible. As long as they meet our criteria for income eligibility, we will serve them. So they're just not left out there in the lurch.
Oh, that's very good.
Yeah.
That's so really are creating and maintaining an important safety net in our community.
Absolutely. Yes, yes.
That's great. Well, thank you for providing a lot of good information.
Well, thank you. I hope our discussion, this information, will encourage people to continue to participate in their health.
Yes, yes.
Yeah.
I hope that's true. Oh, and you know what? I just remembered, I know I always like to emphasize that the colorectal cancer screening, the colonoscopy specifically, that can actually prevent cancer. It's a screening test that can prevent cancer, because during the procedure, if a polyp is found, it can be removed, and then that polyp will not be turning into a cancer.
That's right. And even, as they do the scoping and they remove those polyps, some are benign, but some are precancerous. So the fact that they're there, they need to be removed, because that will decrease your chances for having cancer. So yeah, that's the beauty of it.
Yeah, so that's great. So colorectal cancer screening and the breast and cervical cancer screening programs, I'm glad that you were able to tell us about that, and look forward to more people getting screened and saving more lives.
Thank you.
Great, thank you. And now please stay tuned for this month's Medical Myths.
With school back in full swing, the Frederick County Sheriff's Office is offering citizens a few tips to ensure the safety of Frederick County students. Hi, I'm Corporal Jennifer Bailey. School is back in session and school buses are traversing our roadways. Motorists should slow down and be especially alert in neighborhoods and school zones. They should take extra time to watch for children at intersections and near the roadway as they wait at bus stops for morning pickups and afternoon drop-offs. Maryland law requires drivers to come to a complete stop when the lights on a school bus are flashing, and they must stop in both directions if there is no physical divider or barrier. Remaining completely stopped will help to ensure the safety of students. For children who walk to school, parents are encouraged to make sure their child's path to and from school is a safe route. Wearing bright or light-colored clothing will make children more visible to drivers, and placing emergency contact information inside a backpack can help law enforcement to identify a child quickly if they are lost or injured. All citizens should report suspicious activity or reckless driving immediately. By working together, we can ensure the continued safety of students this coming school year.
Frederick County Parks and Recreation is pleased to announce the Safe Sitter program is now offered at various locations throughout the county. The Safe Sitter program is a national nonprofit that was designed over 30 years ago, which teaches teens to provide safe environments for themselves, their younger siblings, or when babysitting. The program provides accurate medical information and partners with hospitals, fire departments, youth-serving organizations, parks, and more. The course focuses on the knowledge of first aid, rescue skills, behavior management techniques, and life experiences necessary for handling medical, behavioral, or household emergencies. For information on how to register, please call 301-600-2936 or visit recreator.com.
And now here's this month's Medical Myths. Welcome back. This month's Medical Myths is about heart disease. The first myth is that people believe that they would know it if they had high blood pressure or high cholesterol, two of the major risk factors for developing heart disease and stroke. Well, the fact is that until it is too late, many people don't have any symptoms. That is why it is important to get your blood pressure and cholesterol level checked regularly. The second myth that I am sad to hear all too often is that some people whose parents had a heart attack or stroke at an early age believe that it is their destiny to also suffer the same at an early age. The fact is that there are risk factors that can be preventable and controlled, such as smoking, obesity, high blood pressure, and high cholesterol. In a 2007 survey of Frederick County residents, 85% reported having at least one of those modifiable risk factors for developing heart disease and stroke. Another myth is that heart disease isn't as big of a problem for women as some other conditions are, such as breast cancer. Well, the fact is that more women in Frederick County die from heart disease each year than die from breast cancer and all the types of cancers combined. Following a heart attack, approximately 1 in 4 women will die within the first year, compared to 1 in 5 men. So, if you have high blood pressure, make control your goal. Find out what your cholesterol level is. If you are overweight or not too physically active, move more. For more information about what you can do to reduce your risk of dying from heart disease, search online for the Million Hearts campaign. And now here's Angie Blair with this month's Health Tip.
Hello, this is Angie Blair, health educator with the Frederick County Health Department. This month's Health Tip is brought to you by the Environmental Health Services Division. January has been designated by the EPA as National Radon Action Month. By this time of the season, many homeowners have already winterized their homes in an attempt to seal in warm air and keep out the cold. However, during the winterizing process, radon, a dangerous gas that can be harmful to the home's occupants, can also be sealed inside. Radon is a colorless, odorless, naturally occurring gas that you cannot see, smell, or taste. Radon gas is a byproduct of the radioactive decay of uranium, which is formed from the decay of uranium, an element that is contained to some extent in all rocks. The type and structure of the rocks underlying Frederick County make it one of Maryland's highest risk counties for radon in indoor air. Radon can seep into houses through foundation cracks, pores in block walls, floor drains, sump pumps, dirt floors, and openings around utility accesses. Wintertime exposures to the gas may be especially high due to less ventilation and less dilution of indoor air with fresh air. Newer, tightly sealed, energy-efficient homes also lessen fresh air entry and increase the potential for high radon levels and for high risks from exposures to this gas. Byproducts of radon decay may get trapped in your lungs and release radiation, which can damage lung tissue. According to the U.S. Surgeon General, radon is the second leading cause of lung cancer after smoking, and exposure to radon, when combined with smoking, greatly increases the cancer risk. Fortunately, the health risks associated with exposure to radon in indoor air are preventable. There are simple, inexpensive, do-it-yourself radon test kits that can be purchased at most local hardware or building supply stores. Simple, less expensive kits have a short 2 to 7 day test period. More sophisticated and accurate kits test over a 3 to 12 month period to give a better measure of concentrations throughout the year. Alternatively, a qualified radon testing or remediation company can be contacted. If radon is found at unacceptable levels in your home, there are several ways to fix the problem. Cracks and other small openings can be sealed. To address high levels from multiple entry sources, a contractor may be required to repair the foundation or to install a more sophisticated vacuum or ventilation system. For more information on radon, call the National Radon Hotline at 800-767-7236 or visit the Citizen's Guide to Radon on the EPA's website. Thank you for tuning in to this month's Health Tip.
And thank you for joining us for this month's edition of Focus on Health. Please join us next month.